Um, Good afternoon, my beloved audience. It's your friend again, Ishmael Mbithi, coming to you live so that we can continue having healthy related conversation. I hope that you are enjoying my videos. I believe that my videos have educated you in one way or the other, and they have helped to you generally. And so today, I want to give a general education on something very important, something very crucial, and I believe you are going to like it. I believe you are going to love it. And so I want to discuss purely on reproductive health. Reproductive health. And reproductive health has two broad categories. We have obstetrics and gynecology. We have obstetrics and gynecology. And I'm going to go deeper so that I can elaborate more on these two broad categories. And I'm going to narrow it down in a way that you are going to understand in the most simplest way possible. So let's begin with gynecology. Gynecology, it's a branch, it's a category of reproductive health that deals with um, any disorder. Okay, let me say this. This video is particularly talking about women of reproductive age. Okay, so gynecology is a branch, is a category of reproductive health that deals with any disorders that can occur in a woman of reproductive age. So, a woman who is not pregnant is supposed to see a gynecologist. A woman who is not pregnant is supposed to see a gynecologist. Additionally, a woman who is pregnant but her pregnancy has not reached the week of viability. Let me explain this. A woman who is pregnant but her pregnancy has not reached the week of viability is also supposed to see a gynecologist if she has any problem. What is this week of viability? Week of viability is whereby the fetus, the baby that is inside the womb, has reached a stage whereby the baby can survive outside the, the mother's womb. So this baby has grown and has reached a stage whereby the baby is able to adapt to extrauterine life, is able to survive outside the womb of a mother. And we have, depending on various factors, the week is not we can't say it's supposed to be this, but at least it should be 24 weeks. But in the United States, you can see 28 weeks and all that. So between week 24 and week 28, that fetus is viable. In other words, the fetus is able to survive outside the womb of the mother. So I've said gynecology is a category of reproductive health that will deal with all the disorders, any gynecological disorder that a woman can experience is supposed to see a gynecologist. And also a woman who is pregnant but has not reached the week of viability. That is 24 weeks, 28 weeks. 24 weeks ni 6 months. 28 weeks ni 7 months. So between the 6th month of pregnancy or the 7th month of pregnancy, if the mother has not reached that age, then in case she has a problem, she can see a gynecologist. And what are some of these gynecological disorders? We can have infections like UTIs, pelvic inflammatory diseases, polycystic ovarian syndrome, and also other disorders like anemia, like hypertensive disorders. Yes, hypertensive disorders. That woman is supposed to see a gynecologist. Okay, are we together? Because the role of gynecology is to ensure the overall health of the female reproductive system, the overall health of a female reproductive system. So I hope you are getting what is gynecology and what is the role of a gynecologist. So the role of a gynecologist is to rule out any condition, any disorder that this woman can have, any pelvic problems, any fibroids in your uterus, any abnormal growths in your system, any infection. The work of a gynecologist, is to rule out all these conditions, to diagnose and treat appropriately, because some of these conditions can hinder pregnancy, can affect your pregnancy, and then you are not in a position to give birth. If you have a question about gynecologist, you will ask in the comment section. So the other branch, the other category is obstetrics. And so obstetrics is concerned with three things. One, pregnancy. Number two, the childbirth. And number three, the puerperium, or rather the postpartum period. Postpartum period is the period between the birth, immediately after the birth of a child, to 6 weeks after giving birth. So the work of obstetrics is dealing with the pregnancy itself after the week of viability, 24 weeks or 28 weeks. Remember, we said gynecology comes in between age 0 and age 24 weeks, or 28 weeks, depending on where you are. But now obstetrician is coming in after the week of viability. Is coming in after the baby is able to be, like, the baby is able to adapt. The baby can be born and adapt to extrauterine life, can survive outside the uterus of the mother, the womb. So the pregnancy after 28 weeks, the childbirth, and also the postpartum period. So obstetrics is coming in to do these three things. So the pregnancy after 28 weeks can also have problems. So the work of an obstetrician is to handle this pregnancy. Any problem that this mother can have, any maternal blood pressure issues after 28 weeks, obstetrician comes in. And also the childbirth. During the birth, we can have problems. The pressures of the mother can go high. The CS can be done in case this mother has a previous scar or other factors that can be considered to do a CS, whether it is elective CS or emergency CS. So the factors, the environment surrounding the birth of a child, obstetrician comes in. And also, immediately after the birth of a child, we get into the postpartum period. Postpartum period starts from immediately after the birth of the child, after the birth of the child, to 6 weeks after the birth. To 6 weeks after the birth. So this period is called puerperium. It's called puerperium, and it is a period whereby the uterus, the body of the mother, the uterus is preparing itself to return to the normal non-pregnant state. The body is preparing itself to return to its normal non-pregnant state. So there are things that occur here. There are things that happen, and we have three things that happen during this period, between immediately after the birth of the child to 6 weeks after the birth.